6 reasons why unfortunately IVF fails. And after I give you these 6 reasons, I will tell you 3 things every couple must do to increase their chances of having a successful IVF. Number 1, the first common reason why IVF fails is when the egg that is taken from the woman is of poor quality. The second reason is when the sperm the man produces has a poor quality as well. The third reason is when the embryo has a poor quality. So when the sperm from the man is taken and the egg from the woman is taken and they're being joined together, it forms an embryo. It is that embryo that will be transferred into the woman's to continue to grow during the pregnancy. Now, that embryo that is formed by the joining of the man's sperm and the woman's egg can equally have a poor quality. Now, the fourth one is when the womb of the woman where this baby or this embryo is going to grow have a problem. So the older a woman is more likely her IVF may fail. And then the fifth reason is what I call the human factor. The expertise of the medical team that is trying to conduct your IVF. And then, very importantly, the equipment. Because when the sperm from the man and the egg from the woman is joined together, it's put in an incubator. And unfortunately, some people don't have it. They don't have incubators. Another common mistake there, another common reason there is medications and injections. IVF is a very lengthy process. Some women have to take lots of injections and tablets. So the quality of the tablets and the injection you are being given can also affect the chances of your IVF being successful or not. Now, what are the 3 things every couple must do to increase their chances of having a successful IVF? Number 1 is 3 months to the time you were expected to start your IVF. The man and the woman should have started their prenatals, vitamins, and supplements. The second thing you must do to increase your chances of having a successful IVF, you need to do your due diligence. Due diligence is the fact that we know IVF can fail for many reasons, and it's not always due to the competence of the medical team, but because of the human factors I've mentioned earlier. So you need to do your research of the places and the people that are qualified to do this. Now, the third thing you must do before you start your IVF process is sit down with your medical team, your doctor, and have a very frank talk, a very good conversation with them. Why I say this is because I've seen cases some women are giving an advice, and because they are not happy with it or they are trying to be heroic about it, they do something else. So sit down with your medical team. Now, there are 2 types of IVF. There is a traditional IVF and there is a donor IVF. If your eggs has been checked, if your sperm has been checked, and they told you that your chances are low, then you might want to explore the other options that they give you. Because if you keep using poor quality eggs and poor quality sperm, then it reduces your chances of having a successful IVF. So sit down with your medical teams and ask what the specific things you are needed to do. Another advice I will give you is 3 months before you start your IVF process, I will suggest you get my IVF kit. There is egg booster in it, there is twin booster in it, there is ovulation booster in it. Everything comes in a kit. There is vitamins in it, to prepare you so that it doesn't fail. There is also sperm booster in it. Okay? Yes. Nobody will tell you this. I am your only herbalist who got you covered. In one way or the other, you need me, baby. Okay? So it doesn't fail. So it will increase your chances of having a successful IVF. Lastly, prayers, my darling. Prayers, prayers, and keep your mouth